perimenopausal, menopausal women, it's for the calmness? Like less of this and more of like...
One of the root issues with hormone decline is inflammation.
Yeah.
I think when you've got this foundational component, right? Hormones are foundational. Cellular health is foundational. When you've got these things that are now working against us, where there's a promotion of inflammation, that's a huge issue. Most of the patients don't associate, right? So they won't come in and say, "Oh my gosh, Josh, like my joints are hurting and I think it's menopause." Now they'll say hot flashes or brain fog, like they know to associate those symptoms, right? Huge void of adequate healthcare, because what's going to happen is if you walk into an orthopedic office right now and you say, "My hip is hurting," they're going to take x-rays, and majority of the time the x-ray is going to be normal, and they're going to say, you know, it's probably just a little bit of synovitis, which is inflammation of the joint. And we're going to give you some meloxicam, which is an anti-inflammatory. We're going to put you on PT and we want you to rest. All three of those things are helpful. I'm not saying it's not. At what point did they ever say, okay, you're a 50-year-old female and I don't need to know a ton about hormones, but perhaps there could be a component. And if you look at the where the connection is physiologically, when estradiol levels decrease, which is happening in your body. So when estradiol levels decrease, inflammatory mediators like interleukin-1, interleukin-6, tumor necrosis factor alpha, all of those increase. So you're losing your ability to fight inflammation. Does that make sense? So you've got this lack of natural protection around inflammation. So now all of a sudden my joints don't have those inflammatory mediators to combat some of the problems, and therefore joint pain goes through the roof.